This year, MOH will focus more on home-based care development. We will be enhancing the 3 C's this year, as Associate Professor Latif said earlier. And these are expanding capacity, making home care comprehensive, and enhancing caregiver support. First, MOH has and will continue to invest in expanding home-based care services so that more seniors and their caregivers can benefit. We have worked with various hospitals to set up transitional care programs to help patients who are discharged from hospitals to transit smoothly back home. These multidisciplinary teams provide medical and allied health support for patients in their homes after they are discharged, so that they can recuperate and stay well in the community and not have to be readmitted again. Since 2010, we have built up a capacity to serve about 2,000 patients a year under transitional care programs. And we aim to increase this capacity to about 3,300 patients by the end of this year. Second, we are enriching the scope of home care services available and making our suite of home care services more comprehensive so that we can better meet the diverse needs of patients and their caregivers. We know that home visits by doctors or nurses are inadequate to enable seniors to be cared for at home. Seniors who do not have full-time caregivers at home need a lot more personal assistance in a day. Working caregivers are particularly stressed after their parents are hospitalized, and as they have to find new care arrangements and are unfamiliar with how to care for their parents in the immediate period after discharge. In March last year, we introduced a new interim caregiver service. This provides seniors with a much longer period of care. 12 hours of personal care every day for up to 12 days over a period of 2 weeks, right after they are discharged from hospitals. It has helped seniors and their caregivers to enjoy a smoother transition home and given caregivers more time to make longer-term arrangements. With additional help for 12 hours a day, caregivers can also get some rest. This service will be available in all major restructured hospitals and community hospitals this year. This year, MOH will also make available even more subsidized home care services. From the 1st of April, MOH will subsidize the provision of home-based rehabilitation as part of the suite of subsidized home-based services available. Today, seniors can go to day rehabilitation centers for their rehab needs. However, some seniors may not be able to do so because they are still quite frail and may be unable to sit through the journey to the center, or there are physical barriers that make it difficult for them to leave the home to go to a daycare center. We want to catch the window where home-based rehabilitation can help improve their function. A therapist or therapy aide will visit the senior's home to assess and carry out active rehabilitation for up to 4 months. The objective is to bring rehabilitation in a more timely manner to these seniors at home, enabling them to regain as much of their functional ability as possible within their daily living environment and remain independent longer. Eligible seniors can receive subsidies for home-based rehabilitation services from April this year, up to a maximum subsidy of $97 per visit. Home environment assessment will also be added to the suite of subsidized home care services available. Therapists will visit the homes of seniors who are receiving home-based care services to identify home hazards and recommend home modifications to facilitate independent living, like having grab bars or ramps for wheelchairs. This helps them to transit safely from hospital to home. Third, we are making home care more integrated and client-centric. Today, some seniors may find that home care services are delivered in a fragmented manner, with a lack of coordination between separate health and personal care providers. This is not ideal, as an individual's health and personal care needs are closely intertwined. The Agency for Integrated Care will be working with several home care providers to better coordinate, if not fully integrate, home health care and home-based personal care for our seniors at home. Fourth, MOH will enhance the way nursing home, home medical and home-based personal care services are funded to support this integrated approach to care, as Minister had noted earlier. Today, MOH funds home care providers based on the number of home medical and nursing visits made, or the number of personal care hours a client is eligible to receive each week. Such a funding approach is suitable for seniors who only need infrequent or ad hoc home care visits when they fall sick or they need help at home. To encourage providers to take a person-centric view and to own and integrate care for their patients who need home care as a long-term care option, MOH is studying a new way of funding. We are prepared to fund providers not on a per-visit basis, but on a per-client basis, where we will provide a fixed amount of funding per month for each senior under their care based on individual care needs. This new approach to funding will give home care providers a steady stream of financial support so that they will have the resources and flexibility to plan and deliver an integrated package of home services needed by the seniors. We expect to implement this new model of funding in the third quarter of this year. Finally, we will enhance the quality of home care services. The quality of home care services is important because we want to give caregivers peace of mind that their mum or dad or loved one will be well looked after at home when they are at work. MOH has worked with home care providers to develop a set of home care guidelines to articulate the level of care expected of all home care services. This includes good practices to enable coordination of care, enhance quality of care, promote independence and encourage organizational excellence. MOH will be conducting a series of consultations with the home care sector, seniors, as well as caregivers before finalizing the set of guidelines.